Hello, this is Elham Kateeb. I am an Associate Professor of Dental Public Health at Al-Quds University, Jerusalem, Palestine, and I am a counselor at the World Dental Federation FDI. Today, I will talk about the relationship between oral health and systemic health. The link between oral diseases and some of the most common systemic diseases has been established in scientific literature. In the presence of gingival and periodontal inflammation, pathogenic microorganisms from the periodontal tissues enter the blood circulation during normal daily functions through microscopic ulcers under the gum margin. This can activate certain white blood cells in the bloodstream to release damaging oxygen radicals and inflammatory mediators. It can also activate an acute phase response in the liver, resulting in the release of C-reactive protein, which also causes inflammation in the body. Research suggests that inflammatory mediators produced during periodontitis can spill over into the bloodstream and increase the systemic inflammatory burden. In addition, periodontal inflammation can change proteins in the periodontal tissues to make them autoantigenic and to predispose to diseases. Some systemic conditions, which early, emerging, and robust evidence demonstrate bidirectional relationship with poor oral health include atherogenic cardiovascular diseases, chronic obstructive pulmonary diseases, inflammatory bowel conditions, mental health, frailty, type 2 diabetes, aspiration pneumonia, severe acute respiratory syndrome, adverse pregnancy outcomes, obesity and metabolic syndrome, chronic kidney disease, rheumatoid arthritis, neurodegenerative diseases, and cancer. Oral diseases share common risk factors with non-communicable diseases, NCDs. NCDs are the leading cause for premature death in the world. Oral diseases and systemic NCDs, such as cardiovascular disease, cancer, chronic respiratory disease, type 2 diabetes, chronic obstructive pulmonary diseases, and asthma, share modifiable risk factors. Most common risk factors for oral diseases and NCDs are modifiable and include tobacco use, unhealthy diet, harmful use of alcohol, and physical inactivity. By identifying patients susceptible to these risk factors, pharmacists can collaborate with dentists, dental teams, and medical practitioners to prevent occurrence or mitigate disease progression and provide routine and emergency care. In our project at the World Dental Federation that produced those fact sheets, we used an oral health care delivery framework, which is an evidence-based framework that encourages other healthcare professionals to support the oral health of their patients. The oral health care delivery framework include, first, ask questions about oral hygiene, diet, bacterial exposure, acid reflux, and dry mouth. Additionally, ask questions about common risk factors such as tobacco use, cannabis use, alcohol use in a standardized risk assessment protocol. For a specific question, consult the following resources. Then look. Pharmacists should look for signs and symptoms of oral and general health conditions. These include xerostomia, dry mouth, dry and fissured lips, metallic taste in mouth, candidiasis, mucosal lesions, and halitosis. More serious symptoms requiring referrals may include severe halitosis, diffuse melanoma pigmentation, honeycomb plaques, diffuse mucosal swelling, severe periodontal inflammation or bleeding, and dental erosion. Then decide. Decide what conditions require immediate attention. Examples include oral abscess, cellulitis, acute necrotizing ulcerative gingivitis, advanced dental caries, difficulty in swallowing. Decide whether your advice on lifestyle behavior, physical activity, and diet is adequate, or if a specialist referral is required. Then act. Evaluate and initially manage oral emergencies and urgencies, screen for oral diseases and facilitate appropriate referrals, encourage favorable and healthy habits that promote oral and general health, and arrange for the patient's follow-up with oral and general specialists based on data obtained from them. For patients living with chronic conditions like those listed, and particularly diabetes and some cardiovascular diseases, highlight the need to be aware of the relationship between oral health and the condition they have. Pharmacists can be opportunistic during medication dispensing and educate the patients about the importance of oral hygiene, prevent gingivitis or periodontitis, for example. Specific interventions educate patients through teach back, goal settings, and motivational interviewing techniques. Refer all patients with the comorbidities listed previously to a dentist or a member of the dental team for an examination and periodontal screening. After all, you need to document all what you have from patient history, any documented diagnosis, and any management that has been done to that patient. In summary, there exists early, emerging, and robust evidence demonstrating the bidirectional relationship of some systemic conditions with poor oral health. Oral diseases and systemic NCDs share modifiable risk factors, which pharmacists can identify and advise patients on while delivering their services. Lifestyle behaviors, physical activity, and diet play a great role in promoting oral and general health. Thank you for listening, and please refer to those resources and references and in further reading to learn more about the relationship between oral health and systemic health. Thank you.